cholecystectomy is gallbladder removal. And when I put on a permit, I don't write cholecystectomy for patients. I say removal of the gallbladder because most people don't know what cholecystectomy is. And I think that's normal. But gallbladders are oftentimes removed. It's one of probably the second most common surgery we do after hernias. Gallstones are the primary cause of gallbladder trouble, and they block the gallbladder from emptying in the typical scenarios to remove a gallbladder. Extremely common surgery in the world. There's a medicine that might dissolve gallstones. It doesn't work very well. And people could try to maintain a low-fat diet because then you don't stimulate the gallbladder to work as an option instead of surgery. But you would have to become a vegan in many cases to do that, which is totally fine, but it's difficult for many people, and so gallbladder surgery is incredibly common. If someone has gallstones and no attacks, we don't bother gallbladder, but if they start having pains, discomfort, indigestion issues with their stones, then usually they get their gallbladder removed. And it's done, again, typically was laparoscopic. Now we tend to do it with a robot. Adding an advantage to the robotic surgery is we give ICG dye injection prior to surgery. And what that does is the dye is excreted into the liver that then goes into the bile duct system. And on the robot, we have a light we can turn on, and the bile duct will fluoresce bright green. So there's a safety feature added to the robotic surgery, and then we can actually see the bile duct even better than before, because it kind of fluorescent green doesn't belong in your abdomen. So it jumps out at you. And the very worst thing that goes wrong with gallbladder surgery would be injury to the bile duct. Well, it's incredibly rare, but we would like to keep it that way. And this is another little thing the robot can offer.